group of youths singing songs against discrimination are among the people living with HIV and are happy to share their plight with the public as a force of change and perception about how the world views the persons living with HIV. The Uganda Aid Commission launched a national policy to tackle stigma and discrimination of persons living with HIV. Uganda is among the countries commended for the fight against HIV prevalence over the last 3 decades. The policy has 6 key areas it is tackling the problem.
Testing, disclosure, rights to privacy, and confidentiality. The second key area is the rights and access to treatment. The third key section of the policy guidelines is the rights and access to work by PHLIV. We've had instances, chief guest and members, where people living with HIV have been discriminated and denied, even in cases here in Uganda. As UAC, we've received the reports where people are dismissed from work, and for those cases, we follow them up with the Ministry of Gender.
Other participants shared their views on how to tackle stigma and discrimination.
We actually have even pushed that maybe even people like the HIV focal persons at district should be people living with HIV. If after all we are now knowledgeable, we can run our own things instead of having people who are even stigmatizing us being the HIV focal persons.
These guidelines should not become another document stored in the libraries and gather dust on the shelves, but they should serve as a tool of all of us to put into practice the contents within.
It was noted that over 80% of the budget in the fight against HIV is donor-funded. Sarah Kayaji, the chairperson of the HIV Committee of Parliament, gave us an update on the HIV Trust Fund that would enable government fund the various initiatives and programs in the fight against HIV.
As Parliament of Uganda, we have gone back on the drawing board as far as the Trust Fund is concerned. We are working together with the Ministry of Finance and then the Ministry of Health. Right now, we are supposed to establish the board that is supposed to manage the HIV and Trust Fund. So as we speak, Ministry of Finance had shown a negative line of saying that, they cannot collect this money and remit it directly to the HIV and Trust Fund.
It is estimated that at least 1,000 people every day in Uganda contract HIV and AIDS. However, according to MC Katz, the youths are not vigilant enough.
HIV AIDS has been put at the back of their heads. They no longer take it like it's there, they don't really mind. They think having fun and a good time could be more precious than their lives. So I think it's going to be our calling to first of all bring it back to them and tell them HIV is real, HIV is there, and they should take care of themselves. Then also this whole entire thing of gossiping, pointing, segregating people with HIV is still big when it comes to the youth bracket of this country.
The AIDS Commission wants to translate the policy into other languages and signs so that even persons with disabilities are able to comprehend it.
Stigma is described as a perception where someone feels or thinks they are different from others, and if not dealt with, it turns into discrimination and thus leading into violation of someone's rights, which also translates into violence. Something that started as one problem, now one has to fight the various fronts. And critics are saying that if stigma is not fought vehemently, then the fight against HIV is far from over. Sudil Yaruhanga, NTV.